Good afternoon, members. You're hereby summoned to attend a special meeting of the Health and Community Committee, which will be held as a hybrid meeting conducted remotely via WebEx and physically in the Council Chamber, Guildhall, on Wednesday, 11th of December 2024 at 4 p.m. So just take the roll call. So Alderman McMorris.
Online, Karen.
Alderman Montgomery.
Online, Karen.
Councillor Boggs.
Sure, Karen.
Councillor Boyle. Councillor Clark.
Sure.
Councillor Deeney. Councillor Duffy.
Sure.
Councillor Farrell.
Here.
Councillor Harkin. Councillor Heaney.
Apologies.
Councillor McDade. And Councillor Tierney. Councillor Tierney.
Here.
Yeah. And Councillor Hutton.
Forget about me, Karen.
I did actually.
And sure,
Yeah. And Alderman Wilkinson isn't online, I don't think. Okay.
His apologies, it's working, Karen.
All right, we'll move on to the broadcasting statement then. I would like to remind everyone physically present at this meeting or in attendance remotely that this meeting will be broadcast live to the internet and will be capable of repeated viewing. This broadcast may be terminated or suspended in accordance with our protocol. Due to your attendance at this meeting, you're consenting to being filmed and to the use and storage of those images for broadcasting or training purposes, and for the purpose of keeping historical records and making those records available to the public. Members and approved speakers are reminded to only have their mics and cameras on while speaking at the meeting and to use the chat facility to highlight a request to speak. A copy of the Council privacy notice may be found on the Council website. All right, declarations of members' interests we can do now or as we go. Any now? All right, perfect. And we have two deputations today. Our first is to receive a presentation from Karen Wilson, the Education Services Manager, and Rebecca Sowney, and she's the Youth Advocate for Angel Eyes, and we are so happy to have you here. And I will let you have a chat and then we'll come back for some members' questions. Thank you.
Well, thank you very much for having us here today. Yes, my name is Karen Wilson and I am the Education Services Manager with Angel Eyes NI. And we are currently the largest provider of charitable services for children and young people with vision impairment and their families. Currently, we support around 680 families across the province. And basically, I suppose our overarching aim is to ensure that we kind of help remove the barriers to our young people so they have equity of opportunity in all things in life, learning and work so that they can fulfill their potential. May I have the next slide, please? And how do we do that? Well, basically, we are a team of 10, and that is us all there in that lovely photograph. And in the centre, front and centre, is Sarah McCracken. So she is our Chief Executive and founder of the charity. She founded the charity 18 years ago after she had twins who were born with vision impairment and registered as blind. The parent-led element of the charity is something that we still very much have and we're very passionate about. Two of our members in our family services team are also parents of children with vision impairment and other complex needs. And I suppose that's what keeps us very passionate and very authentic in what it is that we're trying to achieve. And so basically, how do we achieve this? Well, we have several services. If I could have the next slide, please. We have our family support services. So that is led by Kerry Cartmel, who's one of the parents. Kerry is a former teacher, and she is supported with Lisa, who's from a child development background, and Janine, who is from a special schools nursing background and community nurse. And really what that support looks like, it's very bespoke. It's the families being referred into us and then providing one-to-one support through conversations on the telephone to actually going out and doing home visits with their families. So that could be, as you know, sensory play, Or it could also be leading different thematic workshops. We're always kind of service led, so we identify what the need is and then ensure that we kind of fill that gap or provide the correct support. So quite lately with the whole, I suppose, cost of living crisis, we already know that families of children with disability are disproportionately impacted, and certainly that's true for then vision impairment. And that has been one of the kind of growing services that we've had in the family support side. Just to give you an idea of numbers, last year, so 2023-24, we issued 314 grants, whereas prior to that, it was about 20 a year. So it really has, that's been something that's kind of just taken off exponentially. But as well as that, then we also have education support services. So that is led by myself. I'm a former teacher, and I'm supported with Sarah, who has lately joined the team, who's also a teacher. And basically what we do is we support families to kind of navigate our education system, which can be quite a tricky one. And that is through assistance at school meetings, support with communication with the Education Authority, and also tribunal action. So getting statements in place, getting the statements to really reflect the needs of our young people and the vision impairment, because quite often when there are additional needs, the vision impairment can fall to the very bottom and almost be omitted or forgotten about. So that's one part of the education services, and I suppose training is another part. We feel that we're quite an innovative charity, and we're always looking for solutions. Through our services, we identified, especially in schools, training to be one of the main issues. And so with Ulster University, we collaborated and developed a level 4 classroom assistant course, specifically for classroom assistant support in children with vision impairment. And again, we roll that out free of charge, so we secure funding, and we use Ulster University's online platform, Blackboard, to do that, and this is a 10-week course. But what we also find then is that for some classroom assistants, that could be quite daunting, who maybe have no prior GCSE or even A-level experience, and kind of find then a university platform to be a bit overwhelming. So quite lately then we partnered with FAIC, who are a charity similar to ourselves in the Republic, supporting families of children with vision impairment. And we developed one-day workshops. So we actually trained classroom assistants in the north of Ireland and then classroom assistants in the south, so that we could also do, I suppose, a comparative analysis to see how education systems were different between the two jurisdictions, and then to be able to make recommendations. That was one of our latest endeavours, and we released a report there quite lately in Stormont just last month. And also with the training then, I suppose we have our VR trainings, that's our virtual reality training. One of the main things that our parents would ask us is, how does my child see the world? And certainly with education, I found that I was going in and advocating on recommendations to make the curriculum accessible and the environment accessible. And whilst we all maybe try with the best that we can, I think our own experiential bias gets in the way, or we see little Johnny kind of running around and we kind of forget that he needs X, Y, and Z put into place. So the VR training is a fantastic way for us to really bring to life what it is like for that child to have a vision impairment and how that impacts them. And that's clinically led training. So what we do is we look at the impairment and we can layer on the various visual functions that are impacted by it to the clinical measurements of that specific child. So it gives a really good replication of how they may perceive the world, and then why we need to make the reasonable adjustments that we do. And whilst we roll that out to obviously schools, like I just said, our family support services also provide that for our families, so that our parents can also experience that, so they understand what they're advocating for or why they need to advocate and how to get the correct support for their young person or child. But we also then have our youth services, and that's when I'll let Rebecca take over.
Good afternoon, everyone. So I am Rebecca. I am the youth advocate for Angel Eyes. So the youth service was started in August 2023, so just coming up to a year and a half. So I suppose the charity found the gap for working directly with the young people, as we've always had the family support, the education support, and that was primarily parents, also was the young people too, but working directly with the young people, away from the parents, promoting independence. So one of the key parts of that has been that it's been youth-led. So at the beginning of that service, I met with all of our young people to see what did they want from the service. There was no point me sort of planning and organising, and it wasn't going to be suitable for them. So the key things that they were looking for was some support with advocating within university and within further education. Another key part was meeting other young people. So a lot of our young people would go to, say, mainstream schools and maybe have not met another young person who's visually impaired. And that has been I think, one of the best parts of the service so far. The young people just really love getting together. We actually had a young person from Strabane recently who we've been working with very closely, and she'd never met anyone else with a vision impairment and came along to one of our events, and she was quite emotional just at the amount of other young people who had had similar experiences to her. And we worked with her and promoted some independence with travel. So she eventually then was able to get the bus up to Belfast on her own to come to our events, which was amazing. We don't just do events in Belfast, so we do actually work all over Northern Ireland. But that was just a challenge that she wanted to put forward for herself, which was really inspirational, really. So another part that we would do would be transition support, so helping the young people when they're going into university, maybe getting into the world of work. So that could be CV writing, helping them with interview skills, with getting into the university, checking the campus, sort of getting a tour of the campus, seeing sort of what the facilities are like, and getting that experience of going around maybe before other students come in or when it's less busy. And then meeting with, say, the disability services at that relevant college or university and working closely with them just to provide the right support and making sure everything's accessible. So again, as I say, it is really led by the young people, and the service is relatively new. So we're constantly developing just to make sure that we're doing exactly what the young people are wanting themselves. So we're developing actually a youth committee starting in the next 2 months, just to make sure that we're kind of continuing the way that they want us to. And next slide, please. So I suppose one of the key reasons I think that we're here today is that our young people came together and spoke about QR codes. So they were saying that during COVID, whenever a lot of hospitality venues were using QR codes for their menus, they found that this was really accessible for them. They could then use screen readers, they could zoom in, they could change the colour of the text of the background or whatever worked for them. And it meant that they could go out on their own with their friends or completely on their own, but not have to have their parents there. And especially then for young people, you know, like 16, 17, they don't want their mum and dad coming with them. So that has been really key to their independence, and they spoke about that with us, and we thought, okay, let's sort of see what we can do about this. So as I'm sure most of you know, then the motion was just passed in August there with the Derry and Strabane Council area. So that is to then promote the use of QR codes with all hospitality venues. So we worked alongside RNIB for that. And that now is in the process of being rolled out, really. So we're looking at how that actually works then in the background. So we're in the middle of producing a document that is of recommendations that we can have on our website that then the hospitality venues can look to. And again, you can create them for free. It's free of charge. It's no extra financial side of things for the hospitality venues. And environmentally friendly. It works in multiple sort of categories, not just for visual impairment. But yeah, so I suppose that's the main thing that we're here today for, really, is for the QR code campaign. And as you can see in the picture, our young people did come up recently, just in, I think it was September, October there, and met with the mayor and had a lovely evening and spoke with her about the campaign and how important it was to them. Yep, next slide, please. So I suppose then next steps for the QR code campaign is, I've spoken a little bit about how to do the how-to guide. So we will create that online. We have met recently with the health committee within Derry and Strabane Council to look at that and what that's going to look like. We did discuss the potential of doing an incentive, so that could be us listing on our website the venues that have decided to sign up to do this, and then we're in turn then promoting those places. Whether we do maybe a sticker in the window, we're not sure exactly yet what way that's going to look, but we're in talks about that. And then also as part of the motion that was passed, all other council areas were contacted and encouraged to do the same. So we're now then starting to reach out to other councils and linking with them as Derry and Strabane are leading the way, basically. And next slide, please. And so true to form, we have a QR code, but that is just how you can contact us if you have any further questions or want, I suppose, any more information at all. And that's us. Thank you.
Thank you so much. I'm going to open it up to the members, just if they have any questions or comments, and I'll come back. So I'll take a few at a time and then I'll come back to you if that's okay, ladies. Any members? Councillor Hutton.
Thank you, Chair, and thanks Karen and Rebecca for coming along today. We really appreciate that you are here explaining to us face to face what Angel Eyes are doing and what you are planning to do as time goes on. But I think, creating a full inclusive society where children with visual impairments can reach their full potential is something that we all have to take ownership of, especially at council level. So this is by creating inclusive environments that nurtures children's emotional, physical, and intellectual development. And it's also about access to services as well. And most recently here, within this council team as well, we had brought a motion in relation to making the Ryan McBride Brandywell Stadium a soccer site stadium, where we have now put in equipment that is enabling families, young people and individuals, adults, to go along and experience the match day experience to the full potential that it can. We've tested the equipment and it's now launching on the 19th of December. So I think cross-party here, we all agree that we need to be the voice for people that have a visual impairment in this city so that they can live their life to the full. And I think it's really important that we do that for young people so that they can grow up and live their life to the full in relation to their education, in relation to their sporting events, arts and culture, and everything like that. So, all services can be adapted, I feel. And at council level, there's a lot of stuff we can do in relation to family support. There's a lot of stuff we can do in relation to educational support, business support, transport, community events, workshops, campaigns, access to technology. So there's an array of stuff that we do. So the more we know, the more we can help. So it's important that we're hearing from you at all stages, because, inclusivity is really, really important. And in my own personal opinion, it shouldn't be something that we need to think about. It should be a natural process in any decisions we're making in relation to development and adaptations. It's not a second thought, or it's not something where you have to come back and go, we need to adjust that. We need a reasonable adjustment for this. It's just something that should naturally come into every plan that we're making. I think the QR code was a brilliant idea, and that is also something that's going to enhance accessibility. And the most important part of that is young people being able to go out, socialise and do it independently and come home and feel as if they've achieved something, and that they spent an evening with their friends and didn't have to have a parent with them or someone that was going to be able to guide them. So I think there's a lot of, I think that the work around the QR codes, there's a lot of work can be done there. There's a lot of, add-ons that can be added on to the QR code, stuff like having it in different languages, if it's going to be a voice, stuff like that, just if we'd visitors into the town. I've been reading up a wee bit on it, and there's just additional features that I hope that it can be brought to its full fruition, and not just sort of the basic QR code. And I'm sure you are all aware, so I'm not going to go over my notes on that. But no, thank you so much for coming along today. And as I say, cross-party, this is a massive piece of work for us. It's stuff that we're looking at all of the time in relation to EDI and in relation to accessibility. So thanks again for coming along. There was just one question, and I don't want to hold you too long. Do you see the educational support? Some of the training that you offer, is it accredited?
Yes, so we basically have the accredited level 4, so that's accredited by Ulster University. So basically that is equivalent to 10 CAT points. And through their flexible suite for learning, it means an adult learner can I suppose do different modules and then get a degree. I think it's 100 CAT points for a degree, so they would have to do 10 modules, and ours would be one of those. It's part of a suite. And then for the actual, so for the VR training, that is CBD accredited, and we provide that for. So just to complicate things a little bit, we're Angel Eyes and we're a charity, but we also have a social enterprise, and we developed that as a way of delivering services to adults. So basically using the VR to promote and support adult services, so dementia, domiciliary care, etc., and vision impairment. And the money that we can get from that then actually goes back into the charity, so that we can ensure that we're delivering our services free of charge to our families, if that makes sense. But that's all CBD accredited. And we're currently developing one specifically for education that is also CBD accredited.
Thank you, Karen, because when I was listening to that, I don't know if you've heard it, OCNNI, Open College Network, they were sort of coming into my head in relation to training that could maybe seep out into the community as a whole, and just educating people around adaptions that could be made, or if there is someone using your service that has a visual impairment. And I know that is all within our disability policies, etc. But they did come into my head, but the CPD is more or less the same. So it was just to ask that question as well. Thank you.
Thank you, Councillor Hutton. Next I have Councillor Harkin.
Thank you, Chair, and thank you to Rebecca and Karen for coming in today, and thank you for such detailed and useful reports. And I think you're right. Look, we have to do everything we can to remove any barriers for children and really everybody to full participation in society, and we have to adjust society to make sure a visual impairment doesn't actually reduce your ability to fully take part. And like the work that you're doing is absolutely helping to drive that forward. What was impressive from your presentation is the youth-led work. I'm glad to hear you're setting up a youth committee. I think that that's so important because, you know, we've had a lot of discussions in the council about, you know, really embedding children's rights in the council, and to think about every motion we put forward and at every meeting, how are we thinking about how this impacts children. And the best way to have a kind of way to do that is when you have children's own opinions about it. So that's very, very important. And the other things that are impressive about the charity is the number of educators and the fact that there's so many family members, families with children with a visual impairment directly involved. And I think that means that you have are very kind of like on the ground in terms of and in touch with what people are challenged with and the needs that people have. I thought what you says about the cost of living crisis and the impact that that's having on families that you're working with is so important. And I mean, we've been advocating very aggressively for the executive to actually implement an anti-poverty strategy. And this is why, because we know how it's impacting families, but particularly families with children that have a disability, because it disproportionately impacts them. So this is the reality of it. You're seeing it in terms of the number of grants, because that's how that's playing out. From the point of view of like the paper that's going to be coming forward about how to progress the QR codes, I mean, obviously we will hopefully be able to do everything we can to push that forward. But surely for the hospitality industry, it's a win-win, because why wouldn't you want to have these in your store to encourage people to come in, to help people access your business? So hopefully that will be taken on and will be championed right across our district, and hopefully right across all the council districts now that they've engaged with us. Karen, you mentioned as well about that comparison. So I have two questions. One is, if you could just say a wee bit more about your engagement with kind of statutory services in terms of how that is, because they're under a lot of pressure right now. But it's also important that they are listening to particularly groups where there's barriers to access the services, and there's where we need to adjust society. So how is that? And then the second thing you mentioned about the comparison between North and South, would you, if you have a couple of minutes maybe, or maybe say something about that, that would be great to get an idea. But thank you for coming in again.
And thank you very much for your kind words. And sorry, Councillor Hutton, I wanted to say thank you as well for all of your support and having us here today. Okay, so to get to your point about statutory services, I mean, it's well known that the Education Authority is under a lot of scrutiny in regards to how they're supporting children with special educational needs. And we know that the department have done their end-to-end review. And certainly throughout our time and having our education advocacy, we have endeavoured to engage with the Education Authority so that they're aware of the issues that we're finding on the ground, basically. So we are in a lucky position that we can collect a lot of data on our families, and we do use that data as a way then to advocate for changes and for the Education Authority as well as the Department of Education to understand how their policy is really impacting our young people. That communication on a whole is Positive, I would say, with the Department of Education, it's a little bit trickier with the Education Authority. I don't think that we're on our own in that. Certainly there are a lot of, like the SEN Reform Group and other parents, parent-led group, etc., have highlighted the issues, and communication is something that is part of the SEN transformation. I suppose their remit of trying to look at that, and it's also part of the end-to-end review. So yeah, I think that's as diplomatic as I have that. In regards then to the report that we did regarding the comparative piece between the Republic and the North. So what we find is that there are elements of good practice in the North and elements of good practice in the South. So for example, our examination access arrangements are pretty good for our children with vision impairment. These are run by the Joint Council for Qualifications, and it's quite clear what our young people can access, and it reflects their normal way of working. However, in the Republic, that's not as good. So their exam papers, they only ran a pilot lately about receiving exam papers in digital format. And also their exam papers aren't really what we would call modified. So whilst you can get it in larger print, really to make printed documents accessible for our young people as well as digital, they really do need to be reformatted. So left aligned, descriptions like you'd use alt text, I'm sure in your own social media, descriptions described, graphs, charts simplified, and that's for those with low vision, and obviously then there's Braille as well. So yes, in the North we do that better. However, in the Republic, they have got a really couple of fantastic initiatives where the young people receive hours in which they can then upskill themselves, and I suppose those extracurricular skills that they need in order to succeed and access the curriculum, such as touch typing and technology, orientation and mobility. So ours are provided for that, for the touch typing itself specifically, but as well as summer provision. So I think summer provision is for all children, and it's a way for those who are more disadvantaged or struggling a little more to kind of catch up on work. But as I say, for our children with vision impairment, then they can use it for lots of other things, like developing those skills that they need to really access the curriculum. The report we do have on our website, and I can send you a link if you'd like to read it in its totality. But thank you.
Thank you. Thank you for bringing that up too, Councillor Hirkin. Can I have a copy as well? I'm a teacher as well, Karen. So just a lot of the things you're saying are bouncing on me here. I know you're trying to be as diplomatic as possible there. I can see that. However, as a teacher, I would really love that training. I've never had training like that, and I've been teaching now 7 years, 8 years. So that's really interesting. I would love that, and I know every other teacher would love that as well, as a CPD opportunity.
And thank you. And that is something that we really want to roll out. Currently, what we do is our families will have the VR experience, and then they would say to us, look, we would love for the school to get this as well. And then we say, okay, we'll get the school to get in touch, and they do. And then we go out, we can network 10 headsets together, and we can deliver that training. So we can train 30 to 40 just by sets of 10, if that makes sense. What we have found through, because we obviously are always thinking about impact and measuring our impact and evaluating and being, a reflective practice to ensure we're delivering the best that we can. But we do like a pre-evaluation, and what we find is around, I think, currently 84% of those who have participated have never had training on vision impairment, and that's what we've found throughout the years. It's unfortunately, the landscape really hasn't changed. So we really started on this endeavour of identifying that we need to upskill this workforce. And in 2018, we did our first pilot with Ulster University. And again, we had the same results then, that the majority, something like 80% of classroom assistants and teachers were saying they haven't had no previous training on vision impairment. And so that's what we've been trying to just then roll out. But you'd be more than welcome to get the training.
I would love that. And even 80%, you're saying that, and it's actually shocking to me. I thought it would have been higher than 80%, to be honest. Because it's never anything that had ever been on my radar. Say you've had training for dyslexia or anything, it's nothing I'd ever even thought about before.
But I'd like to just point out that these are all teachers and classroom assistants who are currently supporting a child with vision impairment. So it's not, I haven't even went out wider. I think if I went wider, obviously it would drop much more dramatically, increase. But no, these are professionals currently supporting these children who've never had training.
Thank you so much, Karen. So I have a few online. Alderman Montgomery, would you like to go first?
Thank you, Chair, for letting me in. I just want to say thank you very much for coming on the chamber. The presentation was fantastic. You talked about there about education and about teachers and training, but I was just wondering, do you have any information nights or any networking information things for the likes of early years? I'm a childminder myself, and I'm always trying to adapt my settings for anybody that's maybe a disability or visually impaired. So when that parent rings me and says, "Can you have your set and adapt to that?" I can turn around and say, "Yes, at present I can't." So just be a bit of information on that. Thank you.
Apologies, I'm not, I think what you're asking is, so basically we're family services. I think that is something that maybe would work for that. So yes, our family services basically kick in from zero. As soon as the parent has a diagnosis, they can be referred into us, or even, I suppose, a questionable diagnosis, because sometimes that can come a little bit later. They can be referred into us, and straight away, like, we will provide support. So that's the emotional support, practical support, signposting, referrals, as I say, the team go out and do home visits, etc. Is that answering your question? I'm not sure if it is. Sorry.
Sorry, can you hear me okay? Because I know what it's like in there. What I was actually asking was, do you have anything in place for the likes of childminders who may be childminding, or a parent coming through to ask about being able to deal with children with visually impaired?
So do we have anything resources specifically for childminders? No, not necessarily. However, having said that, anyone that you know are more than free to contact the charity, and obviously we would support them with any information and guidance as best we can. And again, if that childminder is supporting a child who is visually impaired with parental consent, absolutely, we could deliver the VR training as well, because I do think that raising awareness and kind of empathy and understanding for how the child might see the world really does then kick in. And obviously then we would be providing strategies as well for making that wee child's world more accessible.
Is that okay, Alderman Montgomery?
Yeah, that's great. Thank you very much.
Thank you. Next I have Alderman McMorris.
Thank you, Chair, for letting me in, and thank you to Karen and Rebecca for coming along. I have to admit, before this motion came forward, I didn't really know that much about your organisation, but I have been reading up about it, and the amazing work that you are doing is exceptional. And you know, we talk about you're expanding your impact, you know, and I think that this is a good positive step in order to expand the impact. And I think we all have a role to play within that, you know, speaking to your other colleagues in other council areas, and making sure that, you know, you're getting the platform to come in and do a deputation to them as well, so that they are aware of the services and the support that you provide to parents and families. And I just want to say too about I was really I have a niece who has a child who has visually impaired, and I have to agree with you were saying is basically when they go down the statement route, sometimes the visual impairment definitely is something that's put to the back burner, because they kind of concentrate on the more complex issues that the child have. And I really want to give my niece the information basically so she can contact yourselves, you know what I mean? So that, you know, we are more in tune with what the needs and what the barriers are for this child. I mean, she's only 7 years of age, you know, so she probably hasn't experienced all the barriers herself that she will experience throughout her lifetime. But, you know, we need to have that understanding of what the barriers is. And we recently have done some training through our NIB, and, you know, and before that, you know, we think that we know what the barriers are and the obstacles that people with vision impairment actually have. But whenever we did the training, we were like basically flabbergasted that, you know what I mean, there was so much more barriers and obstacles in the way of people with vision impairment than what we ever realized. So that's really good and really positive. In regards to the, you know, the QR codes. I do agree with the previous speaker, basically saying about, we can expand the functionalities of that, and I know young people now are getting more of a with software, do you know what I mean, in order to advance how they see things through the QR codes and all the things that they can do through that. But I just wanted to say about the virtual reality, and I know you've touched on it. I think that that's really, really vital for people to be able to experience that. And I know Caitlin talked about her as a teacher, but I really do think that the broader society would really, really benefit from that kind of training, especially for family members and different people who would be engaged in like youth services and different things in regards to how they experience life and how life is for somebody that's visually impaired or blind. So well done. Thank you for coming in. I really do hope that the word of this charity gets out right across Northern Ireland, and that we're seeing the good work that you're doing, especially like there's not many organisations who actually go and do the financial advice and grants and stuff like that. So that you're offering a very good wraparound service, and we really appreciate everything that you do, and thank you. But if you could if we could ask one question, just maybe a wee bit more in the virtual reality, can anybody access that, or is it just something that's for families or whatever? Just it would be really interesting. I would really love to do it myself. Suppose that's why I'm asking, but if you can give me a wee bit more information, I'd appreciate it.
Well, thank you so much for all of your comments. Well, I'll start with your last question in the virtual reality. So, as I mentioned, we offer that as a free of charge service to our families, as well as then to schools. We would love to offer it to everybody. Like, we are so passionate about removing barriers, and I suppose that's why we have our social enterprise. They empathise as well. And certainly, if you would like to have, because of your niece as well, really it is, when we say that we offer it to families, it is the extended family also, because we're very aware and very cognizant that quite often, that young person is supported by more than just maybe mum and dad and siblings. It is grannies and grandas and aunts and etc. as well, and great aunts. So certainly through that route for yourself, I think that would be perfect. But on the wider, yes, we want the world to have this training, if I'm being honest. Obviously, we just have to work within our capacity as offering it free of charge within Angel Eyes, but certainly empathise is the way forward, in that we want to roll that out far and wide as best we can, to ensure that every employer and every provider of service is aware of vision impairment, because it is really, I think, important kind of to say as well that the strategies that we're advocating for our visually impaired community are also very supportive of our neurodiverse community. And sometimes we think of, I suppose, vision impairment being a low incidence disability, but what we're finding is it's more an unreported disability or misunderstood, for the reasons that you just spoke of regarding your niece, where when there are other needs, medical needs or physical needs, etc., things that are more visually, you can see, they quite often take precedence and the vision impairment falls to the bottom. But what we find in our experience as well is when that happens, the development of all these other needs is kind of hindered or stopped, because if the vision is supported correctly, everything else will come behind as well. And certainly then to your comment about the statement, please do, direct your niece to us, because that is an area that we really feel that we have an expertise in now, which is going through the statement and ensuring that it is reflective of the vision impairment and reflective holistically of that child, where they are now, and then the correct provisions that need to be put into place, which should be quantified and specified. Thank you.
Thank you very much for that response. Thank you.
Thank you, Alderman McMorris. I have Councillor Farrell.
Thank you, Chair. And ladies, thank you for coming today, just on behalf of the SDLP. Thank you for the very detailed briefing on the work you're doing on a daily basis to assist the families and the children and young people themselves that are experiencing visual impairment. The questions I was going to ask have been asked already, probably repeatedly, but I've got two questions. Would you have a physical presence in the city or the council area? You've said that you operate right across the north. Could you give us some indication of how many individuals you're helping or supporting here in the city? And then specifically on the QR code campaign, what help do you need from us? Because I know we've got a council motion that we're going to support it. What support do you actually need to roll that out? Because I think we want to help here, and we're here to help. So if you could just sort of let us know. I assume you're not doing it all yourself, and we've got expertise, we've got experience here in this chamber and within the organisation here. So some detail on what you actually need from us would be great. Thank you.
Thank you. Yes, I also want to say thanks to Councillor McDade as well for bringing the motion forward originally. So I suppose we're always linking in with young people, making sure it is very much led by them. So we're constantly asking them questions for, as someone has mentioned before, about like technology, digital. The digital world is just changing so much. So we're constantly updating what that's actually going to look like. Like QR codes you can now create from a PDF document you didn't used to be able to. So things like that are constantly adapting. But I suppose getting the word out maybe would be the main thing. I don't know how that works or how that'll look, but once we have the document ready to go, that's going to make it really easy, like straightforward for the venues to use. Getting the word out. But we did speak with I think it was the health committee. I don't know if that's the right terminology I'm using, but they did say that when they're going out to do different inspections and things like that, that they will speak with all the hospitality venues also. So getting the word out is probably the main priority there, really, I'd say. Thank you.
Just a supplementary on that, in terms of promoting that to venues right across the city and district, I'm sure that's something we can help with. But just to Karen, who's here, have we got plans in place to do that? Have we spoken to the marketing team, or how are we planning to assist with that?
Yes, members, the environmental health team met with the chief executive and Rebecca just there at the end of November to start the process of looking at how we would go about developing the QR code. So obviously we're a specialist team and generally an enforcement and inspection team. So we are out on our regular schedule of visits to premises right across the district. So there has been an engagement with the senior officers in that team about how we could work collectively to do that. That's obviously one specific route. Obviously we tie back and then to the marketing support and the media team that's attached from the central resource within council. So we'll be linking in there in terms of all of that as well. So there are suggestions in terms of, is it better to have the sign in the window? How do you best get to your target audience, for example? And again, our team have, fed in their ideas. Certainly there are more ideas, and it may be engagement at a local level with people with visual impairment might actually be something very useful, and looking at how we sort of co-design and develop schemes. So team's open to doing that. So, I've sort of looking and asking about a timescale. So we're obviously in a partnership process around all of this. So when the resource is developed, we will be ready to go in terms of rolling that out and getting the promotion campaign running behind it. Thank you.
Yes, we're hoping towards the end of January that we'll have that all ready to go. And that partnership, as you say, has been established. So we'll be working closely then with environmental health to roll that out. I suppose to answer your first question, I'm working backwards. So we are based in Belfast, our office is in Belfast, but we work all over Northern Ireland. So as we are just based there, but that's not where our services work. So we support families all over. That could be with home visits. We would go out to any part of the country. That would be also with accessible events. So the family team plus the youth team would do separate events, and we would try and make sure that we cover sort of all council areas within like a 3-month period is sort of how we try and work it. We are quite small, so we're trying to cover as much as possible. I think off the top of my head, I know as Karen said, we have 680 families. I think off the top of my head, I could be wrong with the exact figure, but I think it's in and around 80 young people we have currently in the Derry and Strabane area signed up. Thank you.
That's great. Thank you. Thank you, Rebecca. That's brilliant. Last person I have a minute is Alderman Hussey.
Thank you for the opportunity, Chair, and thank you to Karen and Rebecca. A previous answer mentioned, expanding the impact, and it's a bit like following on from Councillor Farrell there. Your presence. Where does it stretch throughout Northern Ireland? And I look at that 680 figure, and to me that strikes me as very low. I would have expected a higher figure. But there again, is it the question of you being able to have that impact and spread throughout Northern Ireland, and getting to that village that it takes to raise the child, and getting that information out. I'm mindful of my years in Strand from 68 to 71. I never heard tell of training and dealing with students who would have visual difficulties. And there needs to be more of that, more of awareness of what is needed for all of the children that we would have to deal with as teachers. By the way, I'm retired 25 years now. And indeed, all of those organisations who are dealing with children, should it be youth clubs, should it be sports clubs, whatever, and it's getting that word out. So it's the awareness matter, and I think that's been sort of hinted at here, that what can we do within that. And Karen, you've mentioned some of that, but just to thank you for the work that you're doing. What would you need? What resources would you need to be able to deal with? I suspect that 680 is the tip of the iceberg, to be quite honest, to deal with the rest of those youngsters in society who are experiencing the difficulties. And I suppose, touching again on a question that Councillor Farrell had asked there, of that 680, if you were to do a scattergraph of where they are, would we, as I suspect maybe, see a big cluster in the east going to the west where it thins out? And again, that's because of the awareness issue. Thank you, Chair.
Money, thank you. So yes, I totally get what you're saying. So basically, it's first and foremost, it's very difficult to get the number of children and young people in Northern Ireland with a vision impairment. And that is something that we would love to look at a legislative level. There are a couple of different ways that the numbers are collected, and the numbers don't correlate. So we've tried that just to figure out ourselves, what is that 680 representative of the entire community? And I can't tell you because I can't get the correct numbers. So that's something we would really love help with, to find a kind of standardized way to gather that data. But yes, I joke about money, but it's true. We are now a team of 10, and we get no statutory funding, but we've done that as a strategic, decision, because we are holding accountable many departments and bodies. So we don't want to then be dictated by those same bodies and how we do or deliver our services. So all the funding that we get is through us continuously sending out application forms. We find where there is a gap, and we find what our service users want, and then we go out and find the funding to try and deliver and put that into place. We're 10 now, but I started with the charity 9 years ago, and I was the first full-time paid employee. So really, we've just kind of grew. Whilst we're 18 next year, we've really only kind of started to grow within the last 10 years, and really only really within the last year. So the year and a half, youth services is only over a year old. We've only, our family support services was just Kerry until quite lately. They have 2 new staff members in. So we've kind of been toiling away and doing the best that we can with the resources that we have. But we are so passionate about what we do that I'm glad to say that we are quite successful in the funding that we're now bringing in. What else? Yeah, so as you say, 680 might be the tip of the iceberg, but we're trying our best to get it out there. In regards to the scatter graph, I suppose, and where our families are located, we're really dependent on our clinicians, as well as our ECLO service, which is part RNIB, part funded by the trust, to make the referrals into us as well. At that point of clinic of diagnosis, in order to make sure that the families know that we're there and we're there to help. So I suppose referral pathways is something that's always discussed and can always be looked at again, and ensuring that those are robust and in place, and that our families aren't falling through the nets. And that would obviously up our figures. And if we obviously have more families needing support, we will always be there to support them. So then we'll go out and find the funding to ensure that we can deliver those services. I hope, does that answer in some way?
Through you, Chair, thank you very much. I suppose, to my own shame, I've never heard tell of Angel Eyes. We've all heard tell of RNIB, but not Angel Eyes. And perhaps therein lies an issue for yourselves when it comes to funding, etc.
Thank you, Alderman Hussey. Councillor Hutton?
Just one last comment. Karen, you mentioned about referral pathways, and I am aware of it because my daughter had premature twins, but premature babies are at risk of sight loss or even visual impairment throughout their life. And our twins had to have those really, really sore eye test, the ones where they have their eyes have to be pried open, the drops, all of that, up until they were 2. So it was just coming into my head about the referral pathways. Some of those children who go out into Sure Starts, they go into play groups. Do you have any linkage there with primary care statutory services whereby you can be brought in to help the families? And that could be like a joint funding application where they may have the money that can be tendered out to you, or vice versa. It just came into my head as you were chatting about those referral pathways, because I do know there is a lot of premature babies who need glasses before they're even 3 months old. And the second point I just wanted to say was in relation to the training. And the training that you have spoke about is excellent, and it does go to that degree level. But I was just thinking around the OCN training, that sort of lower level training in communities, whether it's the community as a whole, whether it's community organisations. And if you do have a social economy element of what you do, that would be a great seller, because everyone's always trying to upskill and be ready and waiting and providing a service that's inclusive. So thank you.
Thank you. And yes, certainly with the workshops that we did lately with FAIC over the last year, that's something, so we have secured funding again through the Shared Ireland Fund in order to roll that out again, but increase in numbers, and including teachers as well as classroom assistants, and including our Braille users as well as our kind of low vision print users. So yes, and we're always again looking at different ways of being able to develop more and do more and get more money in to do the more. And certainly the OCN is something we had looked at previously, and then we went for the CBD accreditation, because we are mindful, as I said earlier, that that university level 4 might put some people off, and it's not necessarily accessible for all, and we're all about accessibility, so we have to always make sure that we're reflective and making things more accessible to raise awareness. And then to your point about Sure Start, etc., we depend a lot too on our social services and making referrals into us. So when a child, if a child has a disability or suspected sensory impairment, it works different in every trust area, and herein lies the difficulties as well. So in some trust areas you will have a sensory support social worker, in others there's only adult services, and others there's children's services, and some is disability. And so again, it's quite difficult to navigate, but our family team are very good, and they're out there and try to be very visible in family hubs. Like we're in all of the family hubs. We're liaising as best we can with Sure Starts, etc., to keep those relationships, to keep building those relationships, and keep raising that awareness, because you're absolutely right about preterm, and certainly more children, numbers of children with vision impairment is rising because of preterm babies, yeah, and the success that these wee babies are kept alive, which is fantastic. And certainly there's a vision impairment called cerebral vision impairment, which is now the biggest cause of vision impairment in children. And that is quite often related to preterm babies or trauma in birth. So yes, we're trying our best. But thank you.
Thank you so much, Karen and Rebecca. Just a couple of comments I sort of picked up as we went there. So I just think like 608 families, as I've said, it's only the top of the iceberg, but I mean, it's still amazing. And you're a parent and youth led organisation, but the backgrounds of your staff, I just think are so phenomenal, and you must be so proud. And then your education support services, I sort of was chatting about it when Councillor Harkin was talking about it there. Just that I would absolutely love to do that VR training. And just to know and support to make the adjustments, even just in my classroom and know. And then the QR code campaign, as Councillor Farrell said as well, anything we can do to support in that. And I'm sure Karen and the team and Seamus and everyone's been amazing. But anything you need, and it's just great that Darren Strabane are leading the way, and then everyone else will follow. But thank you so much, and anything at all, just keep in touch and we will lend a hand.
Thank you. And certainly if it's okay, I will get in touch then regarding the VR training and making that link. And yes, I'm very proud of Derry because I am a Derry girl myself. But thank you.
Yeah, thank you so much, Karen and Rebecca. We will let you go. But thank you so much for coming in. We'll just take a couple of minutes just to get a wee switch over now. First, we will move on to item number 6, and we have a deputation here from Science Swifts, and we have Simon Canning here and Louise Smith. So I will hand over to yourselves, and we'll take some members' comments and questions after your presentation. Thank you.
All right. Hi, folks, and thanks very much for taking the time to see us. I suppose whether it's appropriate or not, I'd just like to commend the previous group, given that I myself am a child of 2 visually impaired registered blind persons, and the work that they do, and know firsthand the difficulties that people with visual impairment suffer. Anyway, sorry, I digress. Look, thankfully, I'd like to the members through the chair and the council representatives here. Just going to try and provide a brief outline about Science Swifts, ladies and girls, and the case that we're hoping we can seek improved infrastructure into this Strabane Arena pitch to enable us and others within the area to continue to deliver services. I'll just jump on the next slide. We can give you a bit of background to Science Swifts, ladies and girls themselves. Look, we have a massive reach for such a small community club. We've over 170 players across 10 different teams. And you'll see there with 25 volunteer coaches, which I, as coach liaison, am one of. We deliver something like between 5,000 and 6,500 volunteer hours per year, just training, matches and attendance and planning in that, as well as then our community members, our committee members, who again, it's unfathomable the hours they put in fairness. The club itself, established back in 2010, have had significant achievements in that short period. If you consider the size of football and its 150 odd year history, and looking at Women's Premier League Cups, Championships, and winning sides throughout. And believe it or not, we've had a host of international players come through the doors, including from the North Republic, Scotland, England, Wales, and even Jamaica as far as, and coming from all sorts of backgrounds. We definitely punch above our weight for the city and district, and we gather players from right across the district, from towns and rural areas, as far as Newton Stewart, the Derg, New Buildings, Strand side themselves, even the hinterlands end of the Glenmore and Ardy-Garvan, all those. We even bring players across the border, believe it or not, from Lifford and Donegal. A massively inclusive club. If I jump on to the growth of the ladies' game, this is essentially the rationale for the start of the rationale for the infrastructure, where the ladies' game's at the forefront of sport and development through and what it offers. We can see there that a 613% increase in registered players from 2019 to 2024, just by the Irish FA here in Northern Ireland. It's unreal. We've seen record attendances at Northern Ireland and England women's games back in 2022. And then equally across the border, we have also seen massive a record attendance for the Republic of Ireland ladies when they played Northern Ireland ladies back in 2023. The game is growing exponentially at this time. And in fairness, maybe the post-COVID climate has actually helped that because of the drive to get more physical and become more healthy. And our concern would be that we don't want to be left behind, given the success of what the ladies have achieved, and then our youth setups, that we would love to continue to offer those health and wellbeing benefits. In terms of the next slide, just a bit of the background here for the strategic context behind this. Look, we try to align ourselves as best as possible to deliver what's being asked of by the council and the community. The strategic growth plan there, which I'm referring to, talking about health and wellbeing outcomes, was looking to deliver the sports area at Melbourne and to build capacity, and it does recognise a greater participation within women and girls in those areas, the social need. I mean, that's the community aspect. Locally then, within the local growth plan, we're looking to maximise the opportunities for participation, and that's something we feel we do very well within Science Swifts, ladies and girls, and the health and wellbeing benefits, which I'm sure there's statistics regarding that council officers would be able to draw upon, regarding all the net benefits, the positive mental health impacts, and the physical attributes as well. Looking at the next slide, we have the council's continued investment is what we're essentially looking for. We know the area has its deprivation statistics, and which be preaching to converted here if I were to start to describe them. But given that the council's own survey, the community survey, did talk about that all respondents, be it physically active, can benefit and improve from general health and well-being, all the respondents agreed with that statement, and we do that. We're a football team. We have children 7 years of age right through to our senior ladies team setups, and a wider connection to that then is obviously then every child's got 2 parents, every child's got 4 grandparents. The community impact and well-being that we have, the reach we have is unfathomable when you think about it. We look to use sports to improve the health and well-being outcomes, but sadly, if you look at the very last piece in pink there, many clubs, and you know this, many clubs do rely on council facilities, and we're no different. And as well as that, we note that females are underrepresented participants, both in terms of volunteers and local sports clubs. There's a bit of wider strategic context on the next slide, which talks about the other strategies. I mean, the Sport England strategy, the playing pitch strategy at the very top. I know the council and that would have used that as the foundation to build upon their own pitch development strategies. We have the Department for Communities, Active Living, Sport and Physical Activity strategy for NI. The Irish FA themselves have the girls and women's strategy plan about developing the game, and we can see that that has occurred when you look at the growth of the game, and as well as that we have the Sport NI and the power of sport, and the power of sport for from health, well-being, physical, all that mental pieces. Not just that, we're looking at developing people, not just footballers. I mean, there's crazy stats about who makes it to the top, but at the end of the day, we want to keep doing what we're doing to help our communities. On the next slide, we look at very briefly some of the council's pitch condition survey back in 2018. This was carried out. I mean, what's fascinating here is that that was identified back then that we're playing catch up to the GAA in terms of pitch provision. And that being said, we ourselves, Science West ladies and girls, are not in the position to develop that infrastructure. We're a small community club. Yes, we punch massively above our rate. We're at the echelon, have been at the top level of the ladies' game against your big Belfast clubs, and that have significant financial backing. And as well as that, in the sports complex in Arena in Strabane, which we're so glad of, and Melbourne itself have seen massive overhauls of recent years, and it's to be commended. The conditions, they're state of the art there. And the audit itself finds the arena pitch, what we're specifically looking at today, as being a good pitch, is well proportioned. And as I say, it has the athletics facility there as well as it's the investments seen the stand of late, fencing and changing facilities, all available on that site. The next slide, just a very simple question. Why are floodlights needed on the Strabane Arena pitch? Well, the ladies' game turned professional in 2023. The top level allowed and permitted multi-line facilities for a transitionary period. That period has now ended. And I'll come to that in a second. The ladies' matches are predominantly played in the evenings due to all the other sporting activities that are going on. So men's football tends to be played on a Saturday morning, Sunday morning, and the ladies played Wednesday, Fridays of an evening. And most recently, after having won the Northern Ireland Women's Football Association Championship, just past, they won a cup and league double. Science West ladies were actually unable to return to the Premiership League. And the reason for that is because our playing facilities at Melbourne, which whilst are state of the art, are multi-use and they don't meet the league's requirements. It has everything else there other than essentially lanes on the pitch. The club has explored using the Brandywell. And as we know, the Brandywell itself is sort of saturated in terms of use with other clubs, etc. Not to mention Derry City's own. And I asked it might be rude of me to say so, but can you imagine a team from Derry having to travel to Strabane to play? And equally, whilst we want to maintain and reach those higher echelons of football, we would prefer to try and stay in our own town and surrounding areas. If jumping on just to look at Melbourne Sports Complex, the top left image you can see, it is state of the art, it's fantastic. We have a multi-use, multi-lined, and in fact, our club could not function without that facility. It's used, we have 6 teams that train on it twice a week. And you can see there that the lines, believe it or not, there's yellow lines in there, there's blue lines on there. And as a result, that does not meet the standards set by the professional game. something like 5 million has been invested there, which, as I say, the whole community benefits from. It is unreal, and we can't do without it. In the bottom right-hand corner is an aerial shot, and if you look to the top left of that image, you'll see the Strabane Arena, the arena, Melbourne Arena pitch, which has seen the development. It's a stone throw away. It's there. There's floodlights on the Astro. There's not on the grass pitch. And I think it's fair as a fair request to maybe for that to be looked at. Just jumping on to the next slide. It's a bit of a graph. I apologise for being a wee bit too technical. Maybe it's my interest in numbers that's led to that, but there's a nice big arc there that shows the average sunset times. It's taken from timeanddate.com. And with the ladies' games being played prominently in the evening, the top line, which is horizontal there, shows, and the bottom line shows when the games start and when the games finish. We're looking at the majority of the games, almost 2/3 of them, actually ending after sunset. So yes, some of the games may only need half an hour, 15 minutes worth of floodlights to enable the game to happen. But you can see the season. The season runs from April to September for ladies football, and 2/3 of it can't function. We have functioned in the past at Melbourne, but as I say, it's down to the markings in the pitch that preclude us, exclude us, from that in the future. And so, jumping on to my final slide there, we're just asking who benefits. Science Swiss ladies and girls obviously benefit. I mean, that's why we're here, and we're very, very thankful for given the opportunity to be here to present to yourselves. Our wider community will also benefit, not only just because of being able to access increased physical activity, but also then the possibility of outdoor events, organisers utilising the space of an evening. I know that annually we have our Halloween fireworks celebrations going off down there. It is fantastically well attended, but again, the limited use due to the lighting. There's also the local athletics clubs, and we have spoke with those members and a council employee, and very supportive. As I say, it's a fantastic facility. Can we extend the use of it into the evenings? And our friends and colleagues at Strabane Athletic Ladies, they too, whilst aren't at the level just yet, are knocking on that door. They've been promoted something like 4 or 5 seasons in a row, and maybe they're trying to get to that level as well. And we would love to see it because it creates this wider competition. I've made a very simple assumption there without using any financial figures, but we have been using the pitch on a Friday evening for approximately 3 hours. So the higher of the pitch there, it costs the club obviously, but by doing so we actually exclude others from accessing the use of the pitch. So the pitches are ordinarily rented out on a half pitch basis to many local communities due to the size and the children, etc., using them. So if you've already worked that out, we estimate anywhere in between 96 to 120 hours worth of 3G booking slots that could be freed up as a counterbalancing financial argument. Melbourne Arena pitch, it's single lined, it's secure, it has its own changing facilities, it has a fantastic grandstand, it's a great facility, and the continued investment we feel is needed to keep this area at the top of the game, top of the ladies' game in particular. And I'd like to commend, I suppose, the councillors and elected members that have supported us to date and have offered their support, and I can see them some here today as well. It's very much welcomed. Look, it could be the perfect venue if floodlights can be added. That's all I have to say. I'd gladly take some questions if there are any. Thank you. Thank you for your time.
Thank you very much. So I'll open it up. I have Councillor Boggs first.
Cormagat, Chair, and thank you very much, Simon, for the presentation. And you're both very, very welcome to the Chamber today. It's great to have you. I suppose you've outlined it very well, and there isn't a lot of questions that I have. I suppose bringing you along here today was to raise the awareness for the rest of the councillors, particularly in this committee, but right across the council chamber, and also for council officers who I know you have had good engagement with, and not just yourselves, but as you say in your last slide there, for Strabane Athletic as well, and for the wider community. And I know that officers have put a lot of time into to try and get us to a position where we will see this come to fruition. But I suppose at the minute the Melbourne Arena pitch, you could say, is like a car with no headlights. It's perfect. It's sitting there. We've done a good bit of work in terms of the actual surface of the pitch and meetings again with council officers recently to try and bring that up to a standard that is acceptable for people to be able to train on and play on. There is a stand there that again, you know, was badly needed to allow other teams to progress through leagues, and I'll declare that I'm not, and I've had this conversation before, I'm not a football fanatic, so when we start talking about leagues and where we can get to and where we can't and where we're falling back to, it kind of goes over my head. But I know that the stand allowed Strabane Athletic Men's in particular to be able to progress where they needed to, and they too are very, very supportive of the calls for floodlights in order to allow yourselves to kind of go through the motions in the same way that they did. But we have a good surface there. We have a stand there that a lot of places and a lot of facilities would love, but we can't use it because we live in a country where it gets dark very quickly for a lot of the portion of the year, and it's just out of use. So I want to just commend you again for all the hard work that you have done in relation to it. And this isn't anything new. I mean, this, if we had have had the money at one point in time, this all would have been done in the one go. But a decision had to be taken in order to separate the two components of the development of the arena out. And as far back as 2022, in February 2022, you know, Michaela Boyle, the then councillor for the Sperrin DEA, had brought forward a motion calling for this, and I know that other councillors have done so since, calling for this to be prioritised and to be upgraded. And I suppose we need to see past the fact that I know you are here presenting today, but we need to see past the fact that it isn't just for one club, it's for the whole development of Melbourne, and we are seeing fantastic investment and development in that space in terms of the 3G pitch is fantastic, as you says, and it, you know, you see rugby teams on it, you see football teams on it, there's Gaelic teams training on it. I mean, it's fantastic. We're now seeing the development in terms of the, you're not allowed to call it a boxing hub, multi-sports hub in Melbourne, which is fantastic. But this is just another cog in the wheel. Hopefully further down the line we'll see the urban sports skate park as well, all kind of cogs to the wheel to a fantastic community and sporting facility. I suppose just kind of to highlight something that you have touched on, but just maybe if you can, Simon, highlight a bit further the impact that not having it is having on the club, you know, in terms of players and fans in particular. I know we have talked about before, but particularly for women's sport. I mean, we all talk in here about, you know, increasing opportunities for women to get involved in politics, to get involved in sport, to get involved in a whole range of things. But in particular, your view as a club, why is there a more negative impact for women's sport in relation to not having this access in your own town? Thanks, Chair.
Through the Chair, thank you, Councillor Boggs, for your question. I suppose not having it, I have alluded to the fact that the club as a whole cannot progress to the top, return to the top level as a result of not having it. But what does that actually mean? It means that we therefore stop attracting players within our region, and they start to go elsewhere. So as a city and district, they start to move away to other places where they can progress. We, as I say, talked about earlier, we have a massive draw from throughout the city and district, but if they start to filter out to other areas, then we lose them, and then we as a city and district then suffer because we can't provide opportunities to progress and to maintain our health and well-being statuses. I mean, I look back to what we've done last year in terms of our youngest age groups. We had a winter mental health program where it involved yoga, it involved mindfulness and that, and physical activity over the winter programs, utilising council facilities again, Riversdale, Melvin and that. And with the lacking of floodlighting on a pitch, it might sound like a very simple thing, but as I say, you open up the avenue for increased use of other facilities. Other clubs can use it. It's not just us. And I know we're here flying the flag, but behind the scenes, people say that's a great idea. It would be great to get more use. So yeah, not having it means that we will remain at Melvin, eat up spots that other teams could be using. Melvin's saturated. I previously have met with other council officials and they've talked about the lack of time slots. And we're trying to free them up. We're trying to, yes, the multi-use, the 3G, the multi-sports, the urban sports are all coming to that area. This is a fantastic opportunity, as I see it, to continue to invest in the area and continue to bring people out of their homes to engage in physical activity, and not having it, we're going to stifle all of that due to the levels that we can achieve and people wishing and wanting to maybe try elsewhere. I hope that answers your question.
Thank you, and thank you for highlighting that as well. Councillor Tierney?
Thank you, Chair, and thank you both for coming along today. I haven't personally had the opportunity to engage with you at this stage or until this stage, but I know that some of my colleagues in Strabane have. I volunteer myself with a local football club, and I know, Simon, you said that you want to stay within Strabane, and I can totally understand that. And imagine a Strabane club having to come to Derry to play their matches. Our club have to travel to Greysteel to play some of their matches because of a similar issue that you're facing. So I can understand your frustration at having to seek out other venues or having to limit the ability that your team have to progress on. In my view, local football clubs have a number of key outcomes that they want to try and reach. For me, two of the main should be development of their players and their club, and progression, and allowing their players to progress to the highest level that they're capable of. I think you've demonstrated through your slides that Science Swiss ladies and girls are capable of progressing, but the facilities is the main obstacle in that. And that's not a position, I think, where we want to be as a council. And, I was here when we had the debates around the Strabane Athletic and the improvements to Melvin then, and they all made sense. That argument doesn't change going the other way. What you're saying absolutely makes sense and should be looked at and supported to try and allow your club to progress, your players to develop, but also the wider impact that it's going to have on our facilities, because everyone knows there's a playing pitch strategy there. Everyone knows that we're short of pitches. We're short of those booking times. You've touched on the Brandywell. The Brandywell is booked out. We all know it. These pitches, for example, in preparation for the Foyle Cup, we ourselves try to get extra training sessions on to get the players to be at a level where they're ready to compete. Having the players and the commitment there to do that isn't an issue, but finding the venues to facilitate it is the blocker. And that's, I would imagine that every club across this district faces the same issues. So the very last slide, the last sentence, it's a perfect venue if floodlights could be added. Makes sense. Councillor Boggs talked about the developments that we're looking to see come on down there. And this is only will further enhance the opportunities available down there. So I suppose I have a question. It's not really for yourselves. It's more for the officers. It's a perfect venue if floodlights can be added. Why can't they be added? And what do we need to do to try and push this on? Because I know that you pointed out that this will have a benefit for other clubs as well in Strabane. I believe it will have a benefit for other clubs across this district because it will free up other venues. It may only be an hour or two here and the wider impact may not be seen. But for those clubs where they might get that extra hour's training before a big game, that's a massive impact, huge impact. So I would like to see how, and I've been here, as I've said already, through the Strabane athletic stuff and all of that. How do we now take this to the next stage where we're not coming back to hear of clubs who are reaching the qualifying stages they progress on, but their facilities or the facilities that are available to them across this district aren't of a standard where they can progress on it, and they're really, I suppose, at their limit in terms of their license to play, but not at their limit for their ability to play, if that makes sense. Thank you. And thank you very much for your attendance today. I really did appreciate the opportunity to hear directly from yourselves, because I have been hearing from colleagues in Strabane, but to hear from yourselves the impact that it's going to have, I think was definitely valuable for me anyway. So thank you again.
No, thank you, Councillor Attorney. And just to I suppose add to that, yes, we massively use Melvin. It's our home, but essentially the home that we don't have. But as part of that, we also utilise other. We actually use schools in the area. So because of some of the facilities they have in terms of the Holy Cross and the Academy, as well as other council owned facilities, including the Glebe Mug and that, and they're all saturated too. And we welcome actually the likes of Dergu training on the Melbourne facility, so they're travelling as well to use more facilities. So look, I'm not here to badmouth the council because I can't praise them high enough for the work that the facilities that have been improved, and it's that continued investment to help deliver the outcomes across the city and district. And you're right, if there's 2 hours freed up in a local pitch down here, then you guys down here, as I say, we're not trying to us and them, but we do have a fantastic relationship with lots of the clubs here based in the city, and we share those ties back and forward, and we're all in the same boat. We all just want the betterment of the girls, and that's the quick term is well, it's the girls, and that's right through the whole way through it. Phenomenal assets to our communities, and by building and shaping more rounded individuals that can deal with the failings of winning and losing in football, it builds you a better community. They can win and lose in jobs, in life, and that builds a better and more robust, stronger community. Thank you.
Thank you, Simon. I am going to just, Karen's going to come on after all the questions and give the officer perspective. I have Paul online.
Thank you, Chair, for letting us in. I'm not on this committee, but I have a good interest in this. I've been working on Melbourne Arena campaign for since it came into council. And thankfully we have seen some refurbishments done to it that has greatly improved it. Thank you, Simon, for the presentation. I am very much across it, in the sense that I did bring a motion to council in September 2023 on the specific a project, i.e. the second phase on floodlighting and given the importance of it. And sometimes when it goes in through council and becomes a corporate position, it can become very frustratingly slow. But it's one of the key things, and probably the importance of your presentation today is about keeping it on the agenda. And it's very important to keep it on the agenda. And I think that for this to be delivered, what we need to be asking and we need to be pushing forward is the practical realities. And that is, how much does this cost to deliver? How much can council fund, if not at all? And if not at all, what is the potential for external funders? And that's what we need to have, because we had a plan, and unfortunately we had to cut off the floodlighting element. Times have changed. We've moved on. We're in 2024, and this is going to be 2025. So costings have changed. So we need the direct practicalities. When we have them, I think that we can be in a position to talk to council and say, for example, of the last year, how much has council made in savings? How much has council saved in recurrent costs that was previously on the responsibility of council? And for example, that is council will be paying £3 million to the airport. If that £3 million is freed up year on year, what is the potential that such projects like this could access that? Because it's been the corporate position of council for quite a long time, and that was recently renewed in September 2023. So I think that's what we need to be driving. And when the previous speaker, Brian, saying from the officer point of view, that's the reports that we need to be seeing. Hard and fact, this is much it's going to cost. That's the plan. That's the approval. It'll meet the criteria, A, B, C, and D. This is what council's got. This is what the shortfall is. This is when we can secure our funding, and this is the start date for the capital. So that's, and a group like yourself, once you get that, that's when I think you can sit and say, let's do another presentation in the council in 6 months' time and say where we at with exactly that plan. But thank you. I'll finish on that. Cheers.
Thank you, Councillor Gallagher. Karen is going to come back on at the end after Councillor Tierney's asked her, so we'll come on after all the comments from members. Councillor Harkin.
Thank you, Chair, for letting me in, and thank you to the representatives from Science Swifts, Women and Girls. And I'm a big fan of football. I love playing it. I love watching it. I love talking about it. And I'm not retired, as some people say. I still play a couple of times a week. But it has amazed me how Science Swifts has, I think you said, Simon, punches above its weight. And I don't understand it, and probably still don't understand it, but you have had a national profile for essentially what is a village, and it's amazing. So you are doing phenomenal work in terms of the women and girls team, and I hope that continues. And you know, I think that the explosion of women's football is fantastic, and I think that it is. I went to university in the United States, so when I was there quite a while ago, I seen not that long ago, but there was at the university level equal funding for men's football, for women's football, and the facilities that women had access to were phenomenal. It just didn't exist here. But we are catching up a bit right now, but I think we've got a lot of work to do. So for me, this is a kind of issue of straightforward equality. There shouldn't be barriers to the progression of Science Swift's team in terms of like their players' access to play at the top league. And so we have to remove that barrier as a council. And I think that floodlights seems to be the way forward. So I think that on that issue alone, I think that this is, you know, the right thing for us to be doing. So I think we have to figure out, as Paul said, what the council can do financially, but also what the council can advocate with our streaming funds, you know, funding streams from elsewhere, because we want the Sandmills team to be able to, you know, achieve everything that's possible and not to lose that profile that it has. So I'm supportive on that basis. I'm also I'm a city councillor, so I think that I'm part of a council that campaigns very aggressively and all the time to address regional disparity. And I think that we have to think about the dynamics within our council area as well. I think that there should be a floodlit pitch for people to be able to utilise in the Strabane area and beyond. And that's just a matter of, you know, the right thing to do. So I think that there's a couple of good cases there for, you know, for this to be done to allow, because, you know, I think that people in Strabane have a right to say we should have a floodlit pitch that we can, where our teams can progress through the, you know, play at the top tier leagues. And that would be both for men's football and for women's football. So I think that this presentation today has been very, very useful. And I think that, you know, hopefully in the chamber we'll be able to work with you to kind of progress this proposal, because I think it's the right thing to do. Thank you.
Thank you, Councillor Harkin. Alderman Hussey.
Thank you, Chair. Not a member of the committee like Paul. Not a member of the committee, but thank you, Simon, for the presentation. This is nothing new. It's been sitting there for years. We're talking about a club that has been there, that's done it, that qualified to do it again, and were prevented by the simple fact that there are no lights available on this particular pitch. I know the club did approach Dergview. That didn't work out because of their scheduling of matches, etc. And I suppose it's been there for so long. I wonder, you know, have our council officers actually costed how much this would cost? And, you know, If not, why not? Because it's something that, the request has been there for a long time. So why hasn't this been coming through on, the capital projects, etc., for at least consideration going forward? To be devil's advocate for a moment, you refer in the presentation that association football playing catch up with GAA. GAA, of course, many clubs have their own facilities. Sion has a fantastic facility if it could be developed, as we know down at the mill. I suppose one could say, Swan Athletic, as we know, have plans to go forward on their own with their own facilities. Resources is always an issue. Do Sion women and ladies, the Swifts women and ladies, have similar plans? Perhaps, I don't know, along with the men's team or whatever, to eventually develop their own facilities in the village that they are supposed to be based in, but actually aren't. But they're not based there because of historic issues and the availability of those pitches going forward. I can only hope that our colleagues across council are listening, that we will see something coming forward to tell us, well, how much would this cost? Can we put it into our capital estimates going forward? How quickly can we do it? Because I think it's an absolute disgrace that Sion did qualify to move up, or to move back to where they should be and weren't allowed. And we're talking, this is a team that's had international footballers coming from that area of County Tyrone. International footballers to play international football coming out of that small club in our district council area, and they haven't been able to. I just hope that we can facilitate going forward. Thank you, Chair.
Thank you, Alderman Hussey. With regard to obviously the costings and stuff, look, we haven't explored that. That's not our strength of suit, and I'm sure there's many rationales and stuff as well. But what we have seen, I suppose, is the development of sports in the game. As a young fella, I remember burning my knees on the tarred pitches that used to be at Melbourne, and couldn't look forward enough to play the next game there, even with my burnt knees. But nonetheless, that's sport in a nutshell. Yes, we're not the only club that could benefit from facilities. Strabane are pursuing their own dream, and again, there are many barriers that we all face, but equally, we've got good relations with all the clubs there. When you mention the Brave facilities at the Mill, I'm a previous coach with Science with boys, because my daughter started out there, because Science ladies didn't have the numbers at that level, and she's now transferred across to the ladies. Hence, I followed. It's normally the way with volunteers. The Sion Boys Club have in the region of 400 and something players in their own right. So can you imagine the saturation? And that's growing. We ourselves, Sion ladies, we have waiting lists. We have to maintain them because we can't. We're at saturation levels with 25 volunteer coaches, and we're constantly looking for more to go through the vetting processes to get the training, the coaching badges, etc., that allows them to actually participate. Councillor Tierney, you're fully aware of that. So there are, I understand, attempts by the boys to buy and ultimately develop the Brave, but that's the purchase of it alone is being dragged out. Bless the lady who passed away who previously owned it, and that will take years. They too are in a similar position. They're a community team. They function on very small income. It's fascinating when you talk about income and the cost and having money to do it. We don't have it. We struggle. I say struggle, but we target ourselves and pitch ourselves at a value that allows people to join, and therefore not excluding people. So in terms of future plans, the dream. 20 years from now, we'd all love a stadium, we'd all love this, we'd all love that, but let's be realistic here. We don't have it, and we're a community-based club. We punch above our weight because of the nature and approach that we have, and Councillor Harkin mentioned it, how and why. I can only come down to the people that we have involved. The people like the chair here, Louise, who've been there for years, who watched her own daughter go through the team and has now subsequently moved on off to university, yet still involved. So there's a passion there, a drive that exists within our members and other members within that area and in other teams to bring forward the betterment of our people. Sadly, we haven't got a never-ending pot of money, and hence we rely on council facilities. So at this stage, no, we don't have any plans to develop our own ground. But if you do happen to fall across a few million, please do send them our way. I'll be entering the Euro Millions again this week.
Thanks through you, Chair, for that. I did say when I was asking that question, I was being devil's advocate, and you've answered the question, and I'm grateful that that has been clarified. Thank you.
Councillor Boggs?
I think Alderman McMorris was in front of me, Chair, online.
No, I don't think she was, but if you want me, I can come back to you anyway. If you, Alderman McMorris?
Thanks, Chair, for letting me in, and thanks, Simon, for the comprehensive presentation today. It's, I suppose it's phenomenal, the amount of numbers that you have playing within your teams. I'm not going to pretend that I'm any expert in associations or leagues or anything like that there, do you know what I mean? But I suppose everybody needs to get behind sporting and leisure, but mainly, do you know what I mean, we need to basically be advocating for women and girls and to be active in these kind of sports. So I appreciate all the work that you do in regarding that. You know, I feel as if like I'm probably not the best qualified to speak on this, but I just feel that there's like an ask of council for all around the district, and I appreciate the disparity between the urban and the rural. Do you know what I mean? So I'm bearing that in mind, but it would just probably be helpful if maybe council can come back with a paper basically detailing the asks and the costings, and I suppose we need to be looking at the priorities and whatever. But as I say, I'm not the expert, but I appreciate the work you're doing, and hopefully we'll get a wee bit more information from council officers in order to give us detail in order to make a better informed decision about how this goes forward. But thanks very much anyway for your input. Thank you.
Thank you, Alderman McMorris. I'm coming to Karen. I just have one comment from Councillor Boggs, and then Karen's going to give us an update then.
Very well, Chair, and I suppose it's not to prejudice what Karen might say, but to ask maybe to make a formal proposal that a paper comes back, even just stepping out what has been done to date, taking into account the hold-ups that we had in relation to having to scrap the floodlights in the first stage of development, and then where we need to go next and what the stages are, because I think, as Alderman Hussey maybe alluded to, it's been going on that long now that everybody's a bit muddled on where we are at and what we have had to go back on and where we need to get to in the future. But it's great to hear so much hope and so much positivity from right across the chamber. But as we all know in here, when you're looking for a capital project to be completed, we all know once you get through the scoping out and all the start of it, we all know how you get it to completion. And it's the same way you get everything through completion, and that's through finances. So I hope all those who speak so favourably of projects like this here today, whenever we have the club in front of us, remember that whenever it comes round to a certain time of the year, whenever that may be.
Thank you, Councillor Boggs. Right, Karen has the update, and she has, you going to see? Yeah, Karen has her update here.
Okay, thank you, members. And it's not because I don't want to answer the question. It's just simply it was to hear a rounded range of views from members in the chamber. And I suppose just firstly to start, the last paper to Health and Community Committee was in March 2024. An indicative figure was given in terms of what the expected level of development would be. There was an open paper, so the figure at that stage was 500,000. We obviously have been engaged in developing other facilities that do have floodlights, so whilst there's a commercial sensitivity around that, we have a more recent view around the Derrick Active project of what a floodlighting project might cost. And that is something that our capital development team are reviewing. And also they have put in place the extent of what a development programme would look like. So I suppose going back to the development of the arena pitch itself with its stand, at that stage we were facing a similar issue in terms of the timeline by which the development needed to complete to allow Strabane Athletics to progress. That led, I suppose, to decisions at that particular point in time as to whether the project was delayed to obtain planning for flood rights. There was obviously a financial package around all of that, and reluctantly, I think from an officer perspective, floodlights were not included. The project is live on the Capital Working Group list. Obviously, there are a series of decisions to be made by members around the allocation of capital funds to a range of projects. This will be one of them. So we can certainly scope out a paper for the Capital Working Group to consider in relation to what we think those costs might well be. In terms of external funding, this is one of the projects that we scoped out to go to DCMS stroke IFA, the grassroots funding programme. They excluded floodlighting from that particular fund, and that's a governing body led programme. So there is, you know, perhaps maybe something that might be done in terms of the club and members collectively looking at how we might influence any future decisions around a second phase of that funding. And I believe that those are under consideration at this particular point in time. But Sound Mills ladies specifically would have been eligible because of your league status to make application for that specific funding. So external funding may be difficult. We don't know what the Sports Council will determine in terms of a future investment programme. We're certainly in conversation. We haven't seen the scope of what that will look like. But again, there are limitations around whether or not they would support floodlighting for grass pitches as opposed to synthetic pitches. So those are obviously views again of another organisation, and there may be an opportunity to influence that. But certainly from a design team perspective, the next phase would be to appoint an integrated design team to take forward the detail that we need in terms of technical design, review the costing, get it through the planning cycle. And obviously those are things that members would want to see progress before there is, I presume, a financial commitment to the actual capital funds. So happy to bring back a paper, members, if omitted to respond to any other question. Happy to pick that up. Thank you.
All right, thank you, Karen. Councillor Boggs, do you need back?
Just in response to Karen's point, something that I did leave out before was that whenever the stand was opened and there was the IFA and that were down, there were commitments made from council in relation to increased use of the whole site, because there's obviously a running track and there's athletics bits and pieces around there as well. And there was a commitment gave to look at how our sports development teams could make better use of that site. So I suppose going forward, maybe if we could have a look at, if we did have floodlights and you were able to use it later at night, not only for football and using the pitch, what other forms of sport or what other sporting activities could we see in that arena? Because I know we all know the increase of our leisure facilities and our sporting facilities and the revenue that they raise to council. So, you know, if we were able to have this site being used for more hours, not just for football, but for other sports, what kind of revenue are we looking at raising that would then obviously have an implication on the cost of that project and others?
Yeah, Karen's happy to take that, Councillor Boggs. All right, Alderman Hussey.
Just to support Councillor Boggs on that, I mean, to look at this, we don't look at it just as floodlighting for association football. We look at a facility that is there that can be utilised more fully for other sports as we go forward. One quick clarification, if I may, Chair, from Simon. Simon, did you say that the use of multi-line is no longer acceptable by higher authorities? The reason I'm asking that is the development of the facility at Mitchell Park will be floodlit, but will be multi-lined.
Yes, so you're right, Councillor, Alderman Hussey, that the regulations set down to us do not permit us to play at the highest level on a multi-line pitch. I'll bring you back to the image that we showed earlier. It's confusing, even as a player, even as children, never mind senior and officials. People are running out to and there's an extra line. There's two lines. There's actually three lines. There's a yellow, a white, and a yellow on the touch line. You go, which one's the bloody line? It is confusing, and that's why. And I can understand that, but at the same time, I understand the council's position because we want to maximise usage of facilities. So, yes, you're right, it does exclude us from using that facility. And that's the regulations from the leagues.
Thank you, Simon. Councillor Gallagher.
Thank you, Chair, for letting us back in. Just to give some clarification to Councillor Boggs there. I know he was relatively new to council, but on the 27th of September 2023, a motion was passed at council, and that motion was that this council bring forward plans for the Stage 2 upgrade of Melbourne Arena that would see the installation of floodlighting. These plans should include the costing, funding secured, possible funding to be sought, and a time frame for completion. So that was passed. That is the corporate position of this council. So it's in the system. It's for council officers to work through that motion and bring it forward, and to bring it forward as quickly as possible. So it's basically what I'm saying is it is council's corporate position to do this, and it should be done as quick as possible. With regards, I think what we were trying to say around rates and rate rises, council this year has made quite substantial savings that could quite easily go into capital funds to sort this out, not about increasing rates. Thank you.
All right. So, just to sort of sum up, I got on there, but no, I'll not even start. Right. Thank you for raising awareness basically on the issue, right? And for coming in and for all your hard work. I can't imagine the hours you're putting in. And I'm sure the kids are so appreciative. And just thank you for giving that opportunity to our women and young people. I think it's so amazing. And as you've probably guessed, we're all completely supportive. So anything we can do to help, we're here. And a paper will be brought back and we'll have a further discussion on it in the future. But thank you so much for coming in. Thank you so much, Simon, Louise.
Yeah, and I'd just like to say thanks very much for hearing us, and thank you to the elected members and obviously the council officers who I know work extremely hard in the background to make these things happen. So thank you to all for having us, hearing us, and for supporting us.
The paper will have to come in too. All right, last piece today. Are we ready? Thank you. You went full teacher there now, Alderman Hussey. I loved it. All right, chairperson's business. I just have one small piece of chairperson's business from Alderman Middle.
Thank you, Chair, for letting me in. I'm not a member of this committee and I really appreciate your good grace in letting me speak today. As a Faughan representative, I wanted to take a moment to offer sincere condolences to the family, friends, colleagues and the wider community who have lost their father, grandfather, friend, colleague and esteemed community worker in the recent and untimely passing of Kenny McFarland. Kenny was well known as being a key worker within many cultural and community groups. He was involved in many working groups through council, including the Strategic Growth Partnership and Rapid. Just last night, I attended an Ulster Scots event at the Newgate Arts and Cultural Centre, where it was remarked that the centre wouldn't be there if it were not for his foundation work that he had spent many hours on, that he had the vision for and that he really spoke for. We will be keeping the family, friends and those mourning their loss within the community during the difficult days ahead in our prayers as they adjust to life without Kenny. Thank you very much.
Thank you, Alderman Middleton, for bringing this forward for us. Alderman Hussey.
Thank you, Chair. And again, not a member of committee, but can I be associated with those remarks? My first encounters with Kenny were back in the late 70s, and it was through the band world when Kenny was and still continued his association with the Pride of Orange and Blue in New Buildings. and assisted many other bands throughout the district. In addition, he worked within the Londonderry Bands Forum, helped establish Solus Centre, worked with Newgate. As has been mentioned, they worked in Rapid, and indeed was a member of our own Rural Issues group on council. And Kenny contributed tremendously to all that he was associated with, as well as being staunch in his own beliefs. He was fully pragmatic to assist him move forward and move the community that he was part of and represented forward. He'll be sorely missed, particularly by his family, but he will be missed by friends and colleagues who have had long association with him. I still remember my last phone call from Kenny not that long ago, and it was seeking support for a particular project, a letter of support, and that was Kenny. He didn't ring you and say, would you? He said, by the way, will you get that written, sent it off to me? And give us a hand, helping the rest of the community. Big man with a big heart. Will be sorely missed. Thank you.
Thank you, Alderman Hussey. Councillor Gallagher online.
Thank you, Chair, for letting us in. Thank you for bringing this. I too have known Kenny for quite a number of years, and I think when he back worked at Villages Together, I think was the name of the project he was in. But I come across him on many venues. Some people across the north and further afield, they make remarks, about the dairy model, and how good the dairy model is around community relations. I would very much say that Kenny was a man that took big risks to play a keen role in that dairy model, and the good community relations that has been built in Derry, Strabane district. He has been very much a key player, and indeed he will be sadly missed, and sorry to hear of his passing.
Thank you, Councillor Gallagher. Councillor Tierney.
Thank you, Chair, for bringing me on, and thank you to Councillor Middleton for raising this so we have an opportunity to pass on our condolences to Kenny's family and his colleagues. I didn't know Kenny as well as some other members on council did, but I have engaged with him over my time in council, through his role with the Bands Forum. Normally, when a decision went through this council that he didn't agree with, or that the Bands Forum didn't agree with, we have engaged with him quite a number of times. And what I found about him was he was never afraid to let you know where he felt that we went wrong, how he and his colleagues within the Bands Forum felt that the views of unionists may have been ignored or may not have been taken into consideration at that particular time. During a number of those discussions, I would like to point out that I disagreed with them, but I think the fact that they were always there trying to make sure and trying to ensure that the views of people from their community were always being considered by this council. I think that's a massive task they take on, a massive responsibility, and one that they continued to do regardless of the outcome of a particular decision. I always afterwards found them very friendly, engaging and personable, and I think I was sad to hear of his passing only a few days ago, and on behalf of the SDLP we send our condolences to Kenny's family and to his colleagues on the many boards that he was involved in. Thank you, Chair.
Thank you, Councillor Tierney. Councillor Duffy.
Thank you, Chair, and thank you to Alderman Middleton for bringing this issue to Council. Like Councillor Tierney, I didn't know Kenny that well. I have met him a few times. Bands for him, absolutely. But likewise, in terms of the year that I was mayor, I did have the opportunity to meet him then, and I have to say that he was always very friendly and reached out to hand friendship. Told you exactly where things were at or where he's seen things. And you know what? Most of the time, it opened my mind to looking at things from a different angle. And I always welcome that because I think that it's really important to be able to look at things from many different sides before coming down on a decision. And I think I remember one particular meeting that we had, and this wasn't when I was mayor, this was the Bands Forum, and it was in Harbour House. And I have to say, I came away with a completely different perspective following that meeting, and I really welcomed it. So I do want to send our condolences to Kenny's family at this time on his sad passing. And he has made a significant contribution to the city and district. And as Councillor Gallagher has pointed out, particularly around the dairy model, which is a model which is world renowned in terms of agreements and peacemaking. So just on that note, sending our condolences to the family.
Thank you, Councillor Duffy, and thank you, Alderman Middleton, for asking to come in on Chairperson's business on this. All right, that is us for today. Oh, well, that's us until January. So have a lovely Christmas and see you then.
Thank
Thank
you,
you, Chair.
Chair.